If you have SIBO, especially if you have very progressive SIBO, you have a lot of issues absorbing your nutrients. When we talk about your nutrients, we're especially talking about vitamin B12 and iron, which is very easily found on a CBC. So this is a complete blood count. All of the blood tests you're going to see on the bottom, I have these optimal ranges charts. So medical doctors and naturopaths look at, or functional medicine docs, look at blood work very differently. Medical doctors are looking at these really wide ranges. If you're out of these really wide ranges, you're in frank disease. There are organ changes that are not working. Naturopaths or functional medicine docs have very narrow ranges for normals. We're looking for optimal health. If you are outside of our very narrow ranges, but within the range of these really wide medical doctor ranges, that's what I call functional. You know, we can treat you with diet. We can treat you with supplements. We don't really need drugs yet. And if you treat in that functional level, you really never progress into the frank disease where you actually need stronger medications or iron infusions or something like that. So a complete blood count, this is what they all look like. When I'm looking at a complete blood count, the first thing I look at is I look at the hemoglobin and hematocrit. Hemoglobin and hematocrit is going to tell me if you have frank disease, if you have frank anemia. So this hemoglobin's 12.9. If we look at my optimal ranges, I want it between 13 and 15. That's pretty close. This hematocrit's 38.2. I want you between 40 and 50. That's pretty close. This guy, I'm not super worried about this guy's iron absorption. The last thing that I look at is an MCV, which is this guy right here. That's called a mean corpuscle volume, and that is the width of your red blood cell. So your capillaries, so the way your blood vessels go is you go arteries to arterioles to capillaries. Capillaries are what are called the site of perfusion. So at the capillary site, all of your red blood cells come out, they feed all of the organs, and then they come back in. Capillaries, however, are really, really thin and narrow, and they can only fit one red blood cell at a time that's going in there. And if you have a lot of really fat, really big red blood cells, it means you can't feed your cells. So I'm always looking at the MCV. This MCV is 92. My optimal is 89 to 92. That's on the top part, my optimal, but it's not enough for me to do anything except maybe tell them to increase their B12 intake via meats, via nutritional yeast, or maybe take a B12 supplement. And then, you know, I'm looking always at the platelets, which is telling me if they're having some kind of acute clotting disorder or anything like that. The next thing I look at is called it's a CBC differential. The differential really is telling me about white blood cell function. So white blood cells, the way that your white blood cell distribution is laid out is super, super important based on how you're fighting pathogens within the body. If you're fighting a lot of heavy dose bacteria, then you're going to have really elevated neutrophils. If you're fighting a lot of heavy dose viruses, you're going to have increased lymphocytes. And if you have elevated eosinophils, then you're either dealing with a histamine intolerance, eosinophilic esophagitis, something like that. Or if the eosinophils are really, really high, we are looking for a parasitic infection. Here's a really good CBC breakdown. So first thing I look at, neutrophils and lymphocytes. Ideally speaking, I want about 2 parts neutrophil to every 1 part lymphocytes. So 60 to 20 would be a good range for me. This person has a neutrophil count of 47, a lymphocyte count of 38. That's getting closer to 1-to-1. And so I'm thinking this person probably might have some chronic viral stuff going on. So I'm going to be looking for that. The next thing that I look for is I look for eosinophils. Eosinophils at a 3 or under, that's pretty much all within normal ranges. I'm looking 3 to 5. I'm thinking allergies, maybe, you know, histamine. It's the springtime. Over 8, I'm definitely thinking parasites. The higher over 8, the more likely they have a parasitic infection hiding someplace. And the other thing I'm going to show you guys is when you're looking at a CBC, at a differential, you'll have this, the percentage, and then you'll have the absolute. It pretty much is the same thing. It's just easier to look at the numbers for the percentage. If your basophils are above 1 or above 3, you are really considering lead poisoning. Which unfortunately in our world right now is happening more often than it should be, even in Portland and Flint, all over the country. So you always want to be monitoring basophilic cycling. Okay, that's the CBC.